Parvovirus B19, commonly known as fifth disease, is currently surging across the United States, with the Centers for Disease Control and Prevention (CDC) issuing a health alert due to rising cases. The virus, often more common in children, is now being reported at higher levels in pregnant individuals, leading to increased concern among healthcare professionals because of the potential complications it can cause. Fifth disease typically presents with mild symptoms like flu-like discomfort, joint pain, and a distinctive rash, often referred to as a slapped cheek appearance. This rash begins on the face and can later spread across the body. According to Dr. Thomas Russo, an infectious disease expert, once the rash appears, the individual is no longer contagious, though they may still experience lingering symptoms. For adults, joint soreness is also a notable symptom, making it essential to be aware of this viral infection, especially during this resurgence. Most children experience a mild fever and respiratory issues before developing the characteristic rash, which usually resolves in about a week. For adults, the virus can lead to joint pain and, in rare cases, more severe outcomes. Once someone has been infected, they develop immunity, which generally prevents future infections. However, those who have never been exposed are susceptible, particularly pregnant individuals, who face elevated risks of complications, including severe fetal anemia. The resurgence of fifth disease is partly attributed to the aftermath of the COVID-19 pandemic. With reduced social interactions during lockdowns, many people who would have naturally been exposed to and gained immunity from parvovirus B19 were not infected, leaving a larger pool of susceptible individuals. Dr. Russo points out that this increased susceptibility is contributing to the current outbreak, as more people are now at risk of contracting the virus. The virus spreads primarily through respiratory droplets, much like many other common respiratory infections. Coughing, sneezing, or contact with contaminated surfaces can lead to transmission. While most people recover without issue, individuals with weakened immune systems, certain blood disorders, or those who are pregnant may be more vulnerable to severe anemia or, in the case of pregnancy, complications that could affect the fetus. Reports from the CDC indicate that more pregnant individuals than usual are being diagnosed with fifth disease, with some experiencing severe outcomes like fetal anemia or miscarriage. Although these complications are not typical, the CDC has noted an increase in such cases during this outbreak. Pregnant individuals should be particularly cautious and seek medical advice if they suspect exposure to the virus. Currently, there is no specific treatment for fifth disease, though transfusion therapy may be an option for high-risk individuals. Symptomatic relief, including fever management and staying hydrated, is usually sufficient for most cases. While no vaccine exists for fifth disease, practicing good hand hygiene and avoiding contact with those who are visibly sick are key preventive measures. Pregnant individuals, especially those around young children, might also consider wearing masks to reduce the risk of exposure.